CES coverage sponsored by Audible.com, where books come alive. Listen to a bestseller on your iPod or MP3 player. You can get a free trial over at audiblepodcast.com/CES.
Hi, this is Carissa O'Brien reporting for the Tech Podcast Network from CES 2011, and I'm here with Paul from Frequency Inc. How are you, Paul?
I'm great, thank you. How are you?
Very good. Your product here, is it the Androiter?
Androiter product, right? It runs on the Android platform.
Very good. Caught my interest. It's in the mobile health category, and
Correct.
We're really curious about how products and technology are helping patients to be a little bit more independent and manage
place,
their health.
Right. It's intended for aging in place and monitoring people who've been discharged from a hospital. So we have an effective solution that's very low cost that can be just dropped into the home. Mm-hmm. Runs on Android phones, Android tablets, Android TVs, any Android platform. Mm-hmm. It uses the common vital sign devices that are available today. These are all Bluetooth devices that communicate to the Android platform. Mm-hmm. So we have things like pulse oximeters, we have things like thermometers, we have blood glucometers, we have blood pressure cuffs, we have weight scales, and we're working on other a little more sophisticated devices, sleep monitoring devices, things like that. So as you can see, the device is connecting right now to devices. This is connecting here to one, and so the data goes into the application, and then the application converts that data to a healthcare specific standard, in this case a CCR, which is a continuity of care record, and then it goes up over 3G and in this case it's populating Google Health and the Google Health record.
Okay, so Google Health, and obviously with the connection of the devices and their mobile device, is sort of the interface for the patient.
In this reference example, I'm using all Android platform devices, and I'm using the Google Health record as the reference EMR, but that could be any electronic medical record. They're standards-based, that we do that standards-based conversion on the phone or on the tablet.
Mm-hmm. Okay. So what is it that's really making it a simple interface for the patient? It's making it a little bit simpler for them to integrate all of their.
Yes, it's an app on a phone or a tablet or a TV. So it's an app. You just launch it, and it can run in the background, and they can be reminded to take their vitals, or they'll have a schedule to do that, and they don't have to do anything. It's very seamless, and there's no wires to trip over or anything. So wireless is cool, but in this case, wireless is safe, right?
Very good point. So what's the price point on something like this?
Undetermined at this point. I'm working with some larger customers like health systems, and thinking in terms of licensing to them. I'm not in the hardware business. We're in the software business, so that will play itself out. This is the debut of the product. I haven't exactly priced it out, and I'm not ready to commit to that.
Sure. Well, so you're thinking of maybe packaging it together, sort of with, if you license it to another organization, they may package it with their devices.
That's
perhaps?
Correct. Or they'll go out and buy the best commercially available devices from a Welsh Allyn or from a Fora or from a Massimo, and there's a number of companies making Bluetooth-enabled vital sign devices. So they'll make the appropriate kind of disease-specific package, and then they'll kind of parachute that into the home, and they'll monitor the people for the amount of time they need to, so they keep them from coming back.
Yep. All right, well, this is on the bleeding edge, folks. This is just being launched and put together for the market. So how can folks find out a little bit more about it in the meantime?
Well, they could visit my website, which is Androiter.com.
Okay. So, and spell that for us?
ANDROITER.com.
Very good. Okay. Fantastic. Well, good luck.
Thank
Congratulations on your first launch, Paul.
Thank you.
And again, from CES 2011, this is Carissa O'Brien reporting for the Tech Podcast Network.